Hello, everyone, and welcome back to another episode of JournaTime. We hold discussions and sometimes debate about important and relevant topics of the society that needs to be discussed. I am Subhashree Burman, your moderator, and today we will discuss about the threat posed by poor availability of vaccines to people of West Bengal with the third wave of COVID looming large. I welcome our three panelists for the session, Ms. Puja Roy Karmakar, Ms. Soumyashikta Sen, and Ms. Bishakha Banerjee. I would like to ask my first question to Ms. Puja. Puja, how do you think the vaccination process is going on despite the shortage in the state government hospitals?
Vaccination program in India was struggling to make an impact initially due to insufficient supply of Covishield and Covaxin. The sharp rise in infections seen in India since February has been disturbed due to the allowing of a large religious festival and election rallies. The central government have been criticized and accused due to give priority for election campaign over citizen safety. India's vaccine manufacturing was affected due to shortage of raw materials, and finally it was hit by a severe COVID wave. The West Bengal Chief Minister has ordered all the district and state-run hospitals to reserve at least 50% of available vaccines. Second dose will be given priority to receive adequate stocks. Complete data available recorded at the official end.
Ms. Bishakha, we all know that there is a vaccination shortage. The behavior of public is not in accordance to the safety protocols prescribed by WHO. People are still crowding in public transports. Local trains, buses, metros are overcrowded. On the top of that, there are less people vaccinated. So are the people of West Bengal at a high health risk?
Fast COVID wave in 2020 has taken a toll on both economic as well as healthcare system throughout the country, and West Bengal being no exception. Situation this year has worsened ever more with the coming of fatal second wave. In West Bengal, strict restrictions were imposed on May 2021 and gradually lifted from 16th June 2021, with government warning against laxity in following appropriate COVID behavior, but in vain. People were often seen flaunting their disapproval in obeying COVID norms, particularly in buses, trains, and market areas. With the opening of transport system for common people, large crowds are witnessed in tourist places with hardly following any COVID protocols. Combining with slow vaccination drive, particularly in rural areas, and careless behavior of people of West Bengal, are inviting another pernicious COVID wave in our state when a threat of third wave is looming round the corner.
Right, we have already discussed some very important points about the looming third wave in West Bengal. I will now move on to Ms. Puja. Puja, how are people getting affected and what threat are we expecting in the wake of third wave?
The Government of India has warned that there may be a chance of third wave of COVID-19 which may be affected in the month of October. It may affect children with similar risk as adults. In the first two stages of COVID-19 pandemic, the children were considered at lower risk so far. The experts committee under the National Institute of Disaster Management said about the pediatric facilities, including doctor staff and supporting equipments like ventilators, ambulance, etc., may be required in case a large number of children if they are affected. According to the report, there is no direct evidence to prove that the children will be more affected in the expected third wave. But the possibility of a third wave may adversely affected children than adults. But now some experts warn that a third wave may strike in the next few months. Court have asked state government over their preparedness, are worried about the new variant Delta Plus. Delta Plus was first identified in India last year that was responsible for the second COVID wave.
Right. Thank you, Ms. Puja. Ms. Soumyashikta, what do you think West Bengal should follow? Which state's vaccination drive in terms of proper distribution and why?
Goa is most successful state regarding vaccination among other states in India. According to the Health Ministry data showed from January 16 to June 17, they vaccinated over 37.35% of its 15.9 lakh population by at least one dose. They did the whole process in a proper systematic manner, and citizens of Goa only got their vaccination slot after registering the Arogya Setu app only. So there was not much dispute in terms of vaccination. Chief Minister of Goa, Pramod Sawant, took the effort to complete the vaccination drive properly. So I feel West Bengal should also follow the vaccination process which was conducted in Goa.
Very true. We have seen how successfully Goa carried out its vaccination procedures for its citizens. So, Ms. Bishakha, festivals are round the corner and we are aware how, due to Onam festival in Kerala, COVID cases have risen. What are the precautions that you recommend for the government of West Bengal in the way of the upcoming Durga and Kali Puja?
Talking you from a high rate of COVID-19 transmission in Kerala, from following a week-long festival Onam, the government on Thursday cautioned that next 2 months, September and October, are crucial in COVID-19 management and warned that festivals should be celebrated with COVID-appropriate behavior as the country is still in the midst of the second wave. The Forum of Durgotsab has requested puja organizers to scale down celebrations in view of the pandemic and has drawn up a list of safety measures that they wish the state government and the puja committees to implement Durga Puja this year. As a precautions against COVID-19, list of safety measures includes full vaccination of the organizers, arranging vaccination of workers, setting up pandals, installing lights and doing other activities, scaling down celebration to avoid big crowds, and planning pandals with proper ventilation. As far as my recommendation is concerned, the measures to be taken decided by the government is worthy enough. If they are followed properly, much will be done for controlling corona.
Right, so people also have to take the necessary precautions properly to avoid getting infected by the virus. With this, I'll move on to Ms. Puja. Puja, I want to ask you about the importance that India gave to the production of vaccines within the country so as to vaccinate all its citizens. Do you think the importance has died down in a way?
The target of Government of India is to vaccinate the entire adult population of the country by the end of 2021. But the question remains over this point whether it will have sufficient doses and the vaccine's quality and also number of manufacturing plant. So the major issues still remain on the production capacity in India. The Covishield and Covaxin are utilized for the country vaccine program. On 20 June 2021, the government has announced to achieve a slightly higher figure of 130 million in a month and to maintain the standard of population quantity. But so far only very less of the eligible population is fully vaccinated with 2 doses. Production capacity could increase in the forthcoming month and some doses may arrive from abroad too. But at this point, the government is planning to vaccinate children may be implemented from next month.
Very rightly pointed out, Ms. Soumyashikta, because of the central and state ministry comes under different parties, do you think their friction create a bad impact on vaccination drive?
Yes, I feel it's absolutely right. We all know there's always a clash between central ministry and state ministry. Because in the West Bengal, the state ministry is from Trinamool and the central ministry is from Bharatiya Janata Party. So when the people and the media person were wanted to know about the reason behind vaccination shortage, the state ministry used to blame on the central government that their side there's some delay to send the vaccine in the state and they are not sending it according to their demand. On the other side, the central ministry used to say that they are providing all the necessary things and the vaccines, those are needed. But because of their fault and negligence, the vaccines were not distributed properly. So people also don't know the exact fault behind the vaccination dispute or delay, and they also not understanding whom to blame. But I feel somewhere it's both the central ministry and state ministry's fault, because when they need to fix the issues or do their work properly, they not doing that. They are still blaming each other, because the most they are concerned about their votes that they will only get by demeaning others and showing them grace, and not at all bothered about the people who are not getting vaccinated. So I strongly feel that the clash between both the parties, it creates a bad effect on the vaccination drive.
Right. So my last question to Ms. Bishakha, what is the responsibility of the people during this COVID time? Do you think government should open up the transport as we see more crowd, since people are heading onto the trains and you cannot really differentiate who is a railway staff or a working person? In that scenario, should we open up the public transport so that the crowd is distributed evenly?
Witnessing the present scenario across the state as a whole, the work life of the urban and rural people is disrupted everywhere. For the sake of earning, the bed people had to get back to their work. Again, they have to take care of their health as well. So, for the well being of the citizens of our state, the state government should open up the public transport strategically. Crowd movement, smooth movement of transport, safety for the public, etc. need to be taken care of hand in hand during this crisis period of the pandemic due to COVID-19. Wearing mask must be made mandatory and fetching passengers only up to the limit of seating capacity are the two most important rules. On its implementation, the spread of corona can be controlled to some extent, and adopting the strategy of providing the ample number of different modes of transport during the office hours can also give a good impact on the distribution of crowd without hampering the work life of the commoners. During the rest of the day, the transport service can be kept as it's operating presently. This will be economically beneficial for the transport providers as well. Hence, with the application of appropriate strategy and implementation of proper rules and regulations, the transport facilities can be increased in number in order to distribute the crowd.
Thank you, Ms. Bishakha. With this, we have arrived to the end of the discussion today. We discussed very important points regarding the third wave that is ahead of us and everything related to the vaccination drive in West Bengal. We now end our session here. Thank you to our three panelists. Do follow us on Facebook and check out our blog site, JournaPost. See you in our next episode. Thank you.